Hey, how's it going, everybody? This is Adam Itzo, here to discuss our Module 4 discussion question. So right off the bat, I think it's important to kind of describe what these health and healthcare disparities are in order to more effectively provide some sort of solution for it. I know it's a weighted question, so there's not obviously going to be a one-off solution. But I think some of the stuff I'm going to describe in this video can be an effective way we can work towards solving some of these issues. So the disparities in health and healthcare refer to differences in health and healthcare among groups that are closely linked to social, economic, and environmental disadvantages. Disparities exist in several dimensions, including race, ethnicity, socioeconomic status, age, place, gender, status of disability, and sexual orientation. Health and healthcare disparities not only impact the populations facing discrimination, but also hinder overall gains in quality of treatment and well-being for the general community and result in excessive costs. Addressing health inequalities is becoming increasingly relevant as the population diversifies. It is projected that in 2050, 52% of the population will be people of color. Large existing disparities in access to health care for people with certain types of disabilities, young adults age 25, and low-income families were reduced over the period when the American Care Act, the ACA I'll just call it, was implemented. Stephan found that the ACA has improved overall access to healthcare and reduced some disparities, but there are still some substantial disparities. For example, as of 2018, Hispanics are 2.5 more times likely to be uninsured than their white counterparts, and individuals with income below poverty are 4 times as likely to lack coverage. Disability status continues to be associated with much greater risk of delayed or forgotten care as well, and mental health disability is associated with increased likelihood of uninsurance. The ACA has largely achieved its goal and should not be rolled back on. However, we need more policy measures to address the remaining inequalities. Cultural competency, defined as the ability of healthcare providers to function effectively in the context of cultural differences, has been shown to improve the quality of healthcare received by racial and ethnic minority groups. As a healthcare administrator, I will discuss with the governing body a rationale for increasing the diversity and cultural competency of the health and healthcare workforce, and describe the key strategies led by the U.S. government, U.S. Department of Health and Human Services, Office of Minority Health to promote cultural competency in the healthcare system and further strengthen community-level approaches to improving health and healthcare for all.